About 30 million prescriptions. That's how often benzodiazepines like Xanax are given out in the US every single year. So your doctor hands you a prescription for Xanax after you mention your recent thoughts and sleepless nights. But should you really be on this medication? Hi, I'm Dr. A. I'm an integrative psychiatrist focused on women's health. Today, I'm talking about what Xanax does to your brain, why it affects women in peri and postmenopause differently, and what alternatives actually work better for long-term relief. Xanax belongs to a class of medications called benzodiazepines. Think of your brain like a car with both an accelerator and brakes. When you have anxiety, your accelerator gets stuck. Xanax doesn't fix the accelerator, it just slams on the brakes. It works by enhancing a brain chemical called GABA, which slows down your nervous system. This is why you can stop a panic attack so quickly. But here's what you may not know. Your brain adapts to Xanax faster than almost any other psychiatric medication. This is called tolerance. It means your body gets used to a medicine or drug after you use it over and over. When this happens, the medicine doesn't work as well as it initially did. You might need to take more to feel the same effect. This is your body's way of adapting to the drug. With Xanax, many people begin to develop tolerance within days to weeks. The rate at which tolerance develops can vary based on individual factors, dose, and frequency of use. But it is common for people to notice that their usual dose becomes less effective after a few weeks. This creates a dangerous cycle. Also, the anxiety you feel between doses may become worse than your original anxiety, and this is where many women get trapped. This worsening anxiety happens because your brain and body make changes to work around the drug, a process called neuroadaptation. Also, the calming GABA system becomes less responsive, while excitatory systems may become more active. When the drug level drops between doses, your brain is less able to calm itself, leading to increased anxiety or withdrawal symptoms. Now, here's where things get interesting for women in the menopausal transition. During this period, there is less estrogen and progesterone, hormones that naturally help regulate GABA, the same brain chemical Xanax affects. Studies show that menopausal women may experience heightened sensitivity to benzodiazepines due to GABA receptor changes in their brains. But there's more to this story that I'll share in just a moment. You may have been prescribed Xanax by your doctor, but what you may not realize is how difficult it could be to stop it. Unlike antidepressants, which might take weeks to work, Xanax provides almost immediate relief. This instant gratification creates a powerful psychological dependency. Your brain quickly learns that a pill equals relief. Unlike antidepressants, which might take weeks to work, Xanax provides almost immediate relief. This instant gratification creates a powerful psychological dependency. Your brain quickly learns that a pill equals relief, but the relief comes at a cost. Memory problems can develop that mimic early dementia, making it difficult to distinguish between medication side effects and cognitive decline. The increased fall risk becomes a serious concern as we age, particularly when combined with other age-related factors that already affect balance and coordination. Perhaps most troubling is the paradoxical reactions that can occur where Xanax actually increases irritability and anxiety rather than providing the expected calming effects. This creates a confusing cycle where the medication meant to help can actually worsen the very symptoms it's supposed to treat. Additionally, dangerous interactions with alcohol pose significant risks. Even a single glass of wine can amplify the sedating effects of Xanax, leading to potentially life-threatening respiratory depression or severe impairment that increases accident risk. And perhaps very concerning for menopausal women, Xanax can worsen the very symptoms you're already battling: brain fog, anxiety, and sleep disruption. I'll never forget my patient Kylie, a 49-year-old executive who came to me after 3 years on Xanax. I started taking it for panic attacks during perimenopause, she told me. Now, I can't remember conversations from yesterday, and my anxiety is worse than ever between doses. Now, I'm not anti-medication. There are specific situations where Xanax can be appropriate. For very occasional use during acute anxiety episodes, using it not more than twice weekly can provide necessary relief without creating dependency patterns. It can also serve as short-term relief during a crisis situation, but this should be limited to under 2 to 3 weeks to prevent the development of tolerance and dependence. Additionally, Xanax can be helpful for specific phobias like fear of flying, where the medication is used infrequently and for a clearly defined, time-limited situation. But for the chronic, daily anxiety that many women experience during perimenopause or postmenopause, the research is clear. Long-term benzodiazepine use creates more problems than it solves. A study found that menopausal women who used benzodiazepines for more than 8 weeks had significantly higher rates of depression and cognitive issues compared to those using non-medication approaches. So what actually works better for anxiety during the menopausal transition? I'm about to share the 3-part approach I use with my patients that addresses the root causes of menopausal anxiety. But first, if you're currently taking Xanax, please don't stop suddenly. Benzodiazepine withdrawal can be dangerous and requires medical supervision. Always work with a healthcare provider to taper safely and effectively. Now, here are safer alternatives. Number 1, hormone balance. Estrogen doesn't just affect hot flashes, it profoundly impacts the brain's anxiety response. Working with a provider who understands the connection between hormones and mental health can be game-changing. For many menopausal women, targeted hormone support through bioidentical hormone therapy can dramatically reduce anxiety. Number 2, nervous system regulation. Your nervous system can get stuck in fight or flight mode, especially during the hormonal shift in perimenopause. Daily practices that activate your parasympathetic system are effective in counteracting this. Diaphragmatic breathing offers one of the most accessible tools for regulating the nervous system. Just 5 minutes of slow belly breathing using a pattern of 4 counts in and 6 counts out helps calm your nervous system. This simple technique can be done anywhere and provides immediate calming effects. Cold exposure, such as finishing your shower with 30 seconds of cold water, increases stress resilience. This practice helps build what researchers call stress inoculation, making you more adaptable to daily challenges. Heart rate variability training using apps like HeartMath can retrain your nervous system response over time. Number 3, targeted nutritional support. The anxiety-nutrition connection is powerful, and even more so during the menopausal transition. Strategic nutritional support can address the underlying imbalances that contribute to anxiety during this phase of life. Magnesium glycinate, taken at 300 to 400 milligrams daily, is particularly important since many menopausal women are deficient in this crucial mineral. This form of magnesium is well absorbed and supports nervous system function while promoting better sleep quality. Omega-3 fatty acids play a vital role in reducing inflammation in the brain. These essential fats help stabilize mood and support overall brain health. Blood sugar stabilization represents another critical component of anxiety management. Eating up to 30 grams of protein and healthy fats with each meal helps regulate blood sugar levels and reduce cortisol spikes that can trigger anxiety. My patient Riley implemented these 3 approaches and was able to completely taper off Xanax after 5 years of dependency. If you're currently taking Xanax and want to reduce or eliminate it, here's what you need to know. 1. Never stop abruptly. Work with a knowledgeable provider on a gradual taper. 2. Implement the natural approaches first before reducing medication. 3. Consider initially transitioning to longer-acting benzodiazepines like Klonopin. 4. Be patient. Healing your brain from long-term benzodiazepine use takes time. Talk to your doctor about your anxiety. There may be room for other treatment modalities like SSRIs depending on the severity. But to learn more about natural anxiety solutions for this hormonal transition, watch my next video on the top 5 supplements every woman needs to know about.